Dr. Justine Alley is a veterinarian of 23 years and co-owner of the Strand Vets. Growing up in South Africa, she made the big leap to the land of the long white cloud in 2008, working in several practices before finding her happy place with her business partner, Dr. Megan Alderson, at the Strand Vets, Parnell, a bespoke clinic whose goal it is to step into pet owners' shoes for an individual approach to their pets' health and well-being. Thank you for joining us, Justine.
Oh, thanks so much for having me.
No problem. So you're not busy right now? We're not going to see any animals like darting across the background of the Zoom?
Good option. You can never say never in a vet clinic.
Very true. So we'll kick in. What does wellness mean when it comes to pets?
Wellness is really embodies preventative medicine. So thinking about what we can do to improve the longevity or the welfare of the pet, reduce suffering, improve quality of life. Like, what can we actually do rather than just seeing them for their vaccinations or for skin complaint or gut complaint? What can we actually do? Thinking about the long term of the pet to prevent the issues that they may be predisposed to, or slow progress of things that they may have.
And is that a pathway? So it kind of is. I know that you've got a care model that's quite specific and not common within, I guess, the pet space area. Can you speak us through what that care model is and the Strand Vet's point of difference with that?
Yeah, so our time to care model is really about giving space, 1 for the owner, 2 for us, and 3 for the pet. So if you think about the pet coming into the clinic, it's quite a foreign environment for a dog or cat to come into, to be popped, if they get whisked onto the table, there can be a lot of fear and anxiety around that. So allowing them to come in, settle in, whether it's a dog or a cat, we have a specific cat room with a little hidey box, and they can go into the box and they can decompress after their car ride. The dog can run around the room, get a few snacks, just settle in, smell the smells, get used to everything, and it makes them a lot more relaxed for the clinical exam. So it does actually make our lives a lot easier too, but so much more pleasant for the dog, or the cat. So they're more amenable to the clinical exam. They enjoy the process. It's not necessarily scary for them. Next time they come into the clinic, they're actually so much more relaxed. So especially if it's a second or third visit, they actually go, oh, I remember this place. I had a good time. They run straight to the corner where the treats are.
Naturally, they're like, this is that place I get those awesome treats. Yeah.
Yeah, so just giving them some time rather than rushing into things, letting them settle in while we ask the history and see what's going on. It also means that we can do half-an-hour consultations, so we can do a really thorough physical exam. So it might be that you come in for skin complaint, but actually in doing the thorough physical exam, we find a broken tooth that we need to do something about. And, so looking at not just the problem that occurs or that you can for. And then also just for the client to be able to ask and address any concerns they may have. So rather than you're just actually having time, they may have a few questions that they want to ask. They may not understand something fully, so we've got time to explain it all. And then also to look at the things that they didn't necessarily come in for, so, i.e., giving recommendations, what treatment might they need, what supplements may they require, what surgery may they need. So it's all round so much more a pleasant experience for all of us.
Yeah, well, I mean, I guess kind of needing them into the new space does, to your point, take a bit longer, but it makes them more relaxed, which makes it easier for you instead of having some anxious, crazy, what's happening to me animal. I guess when you mentioned teeth just then, what's, I guess, one of the most missed concerns that an owner of a much loved pet may not even notice? Like, what are the signs to keep a lookout for?
I think the most missed problems are both dental disease and pain. So dental disease, we will notice in our own pet, but only really when the mouth becomes really smelly. And by that stage, it's quite far advanced. So there could actually be tooth root abscesses by that stage, or really rotten mouth. So the early stages of dental disease, you may smell something if you get right up close, but it's very seldom that you will actually notice it unless you lift the lip. So with dental disease, we would say, get used to flip the lip, as we sometimes call it, just lifting up those lips and having a look at the teeth right to the back on a regular occurrence, and ideally some level of dental care, because like we know, we brush our teeth twice a day, every day, and still need to go to the dental hygienist at least once a year. And so we know that, yes, maybe some dogs and some cats have better dental genetics than we do. But in the vast majority, be about 80 to 90% of pets will have dental disease by the age of 3. So, and then it's ongoing from then on. So some level of dental care is really important, and we can tailor it to the pet or tailor it to the owner, what they can actually manage. And then pain is a big one. We really, I think cats and dogs are their own worst enemies, especially cats, in that they will hide pain, and actually sometimes quite significant pain. So they do it as a protective mechanism, but that means that we miss it, and it means that problem doesn't get addressed. So they'll carry on eating with a rotten mouth, they'll carry on eating with a broken tooth, an abscess, and they'll carry on walking or jumping with a really arthritic limb.
Oh, wow.
So sometimes it's incredibly subtle little things that we need to look out for in order to detect those problems. And that's really why regular vet checks, we're recommending biannual, so every 6 months, because some of these things are so subtle. Even if we'd asked you to look out for it, it may not be possible. So those regular checks, you think about a year in a life of a pet is about 7 human years. So it would be like not going to your doctor or your dentist.
There's a lot that can go on in 7 years, right?
Go on in 7 years. So, having those regular checks, so you're picking up those hidden problems.
And are there any, does winter make a difference to pets in terms of their health?
Certainly from an arthritis point of view, we know as people, if we've got problem joints, that they do become more painful in winter, or more noticeable anyway. So definitely, we go through summer with your common complaints like gut problems or skin problems, and things do seem to settle for most pets during winter. So we normally recommend that's a great time to actually catch up on all the other things that you haven't had a chance to catch up on during the summer months. Now winter's time to go, okay, how do we look at that preventative health? How do we check that their bloods are okay? All those kind of little hidden things. But for our senior pets, or any pet that is born or developed a joint issue, winter's really that time that we want to start focusing on them, making sure they've got everything they need, making sure they're as comfortable as possible. And so that's the time, as it starts getting cold, is really the time you want to start addressing that.
When you speak of joint pain and things, it makes me think of human beings as we age. It's something that's far more common. Do pets have an aged care type health plan that they, as they age, they kind of have to jump on and things change for them?
Definitely. I think that the hard bit about that is there's no hard and fast rule, and some will age faster than others. And so we try and keep things quite individual and tailored at the Strand Vet. However, we have general ideas around, when we're likely to see things happen. And I think it was 90% of cats by the age of 12 have arthritis, so we know if we see a 12-year-old cat that's, even if it's not showing symptoms, it's guaranteed to have it. We know that things like kidney disease start to creep in around the age of 8. And yes, they may happen a bit earlier, but those are the kind of times that we start really looking for things like that. So as they head into their senior years around 8, and then into their super senior at around 12, is when we start doing even more checks, and we might consider doing blood tests twice a year or every 3 months, depending on how old they are. Even when they're young, though, we do recommend those blood tests annually, because there's so many things that we just wouldn't know are there. And if you can pick it up early, you can do so much about it. You know, so you can put them on a different diet, or you can put them on a supplement and slow it down. And if you wait until they've actually got clinical symptoms from it, it's often too late to treat. So yeah, those blood tests can be a really great thing to do in winter.
Yeah, that makes sense for humans as well. What is, I guess, you know, in the vet space, have you noticed that, because pets aren't just pets, I'm loath to just speak so generally because they're a member of the family. They are loved as much, you know, in many homes as the children themselves, kind of thing. To keep an eye across pets, what's one thing that the humans can do to take care of, I guess, just the general health of a home for pets? You know, is it like, I don't know, minimizing dust? Is it, you know, some pets eat once a day, some pets eat 3 times a day. I know it's very kind of general, but what would the baseline home tips be to keep your pet healthy?
I think, you know, obviously we want them to be able to have a warm shelter area in order to live. So somewhere that's dry and warm. We want them to have good quality foods, ideally really good quality nutrition. So we know that that is going to set them up for success long term if it is easily digestible, high quality. Looking at things like your flea and worm treatments, so preventative things, vaccinations. And then other things at home would really be, and we're pushing this quite a bit over the last few years, is enrichment at home, because you know a lot of people work long hours, and then how are they left at home alone? And if they are left at home alone, what are we doing to avoid boredom? And then because boredom leads to problem behavior, and then you know either the neighbors get upset at barking dog, or they start urinating inside, and that's unacceptable. And so what we don't realize is actually a lot of that is stemmed from boredom in the first place. So what can we do to enrich their environment? You know, is it that we you know, freeze some treats and they get hidden around the garden, or use treat balls for a cat that they chase around during the day, or you know, whatever it may be, just some kind of using their brain when there isn't someone around, so that they can actually avoid that boredom factor and proper behavior. So I would say shelter, food, water, preventative care, and enrichment is really important.
Awesome. And being a human being yourself, what do you do to, this is a wellness promo, but we thought it was so great to actually discuss pets because they're a member of the family, right? But what do you do to keep yourself, I guess, in potentially tip-top shape in the cooler months?
I suppose cooler months is hard to say, but I think it is, maybe it's, for me is, you know, the cooler months often come with rain as well. And I know that even with our dogs don't get walked as often during winter because it's raining, but we know how important getting outside is. We know how important exercise is to our mental health. And so it's focusing on, you know, not becoming a couch potato during winter. And we talk a lot about the Te Tapawha in our clinic, and we've got a program called Vet Thrive, which helps the vets, you know, with coping in a stressful industry, but just looking at our mental well-being and how we can optimize it. And it is about, you know, not just one pillar, not just looking at how you eat, or not just looking at how you sleep, or not just looking at mindfulness, but actually going, well, have I got every aspect, every pillar in my sort of mental well-being package really that looks after, you know, am I seeing friends and family? Am I getting enough exercise? Am I looking after my mental well-being? And you know, whether it's spiritual or whatever it is that completes that package for you. And so for a lot of us, it is getting out into the water or getting out into the greenery, because we just feel so much better afterwards, even if it does seem like the craziest idea because it's pouring with rain.
Put your jacket on, you'll be right. Yeah.
Cold and you just want to stay by the fireplace. But I think it is just, yeah, that really makes a big difference.
Well, thank you very much for your time. Thank you for your brilliant tips on pets and for ourselves as well. Good luck with the colder months for the patients and the staff.
For all of us, yes. Thank you very much.
See you later.